Okay, I'm scheduled to pass morning meds, and I need to pick out my bubble pack, so I'm going to find my patient in the drawer, and I'm going to find, I'm a collector, and that's who I'm passing. I'm passing 2 meds today. I'm scheduled to pass Lasix, and I'm also scheduled to pass digoxin, so I'm going to pull those out of the med cart. That's going to be my first check of my medications, and I'm going to just put those off to the side, and I'm going to go let my instructor know that I'm ready to pass my morning meds. Hi, Luann. I'm ready to pass my morning meds.
Okay, hi Lori. Well, good. You've got all your assessments ready?
I do.
Okay.
I got them done before I came in to pull my meds.
All right, real good.
Okay. The first thing I'm going to do is I'm going to do my second check now.
Okay.
And this is, I'm a collector.
Mhm.
I'm a collector. And her birth date is 7/15 of 40. 7/15 of 40. My first medication is Lasix, 40 milligrams PO daily. Lasix, 40 milligrams PO daily. And the expiration date is 2 of 14.
Wonderful.
Okay.
What month are we dealing with here?
We're dealing with February.
Wonderful.
Okay. She doesn't have any allergies to medication. She just has hay fever.
Wonderful. Great.
Okay, so that was my second check. So I'm going to go through my med sheet now. And furosemide, she's taking 40 milligrams PO daily, which is within the normal limits. She's taking it for congestive heart failure.
Okay, good. And what's that medication trade name?
The trade name is Lasix.
Good, good.
Okay, and furosemide is the generic name. It inhibits the reabsorption of sodium and chloride in the loop of Henle.
And where is that loop of Henle?
That's in the kidneys.
Beautiful.
It actually is going to make her urinate.
Beautiful.
Okay.
What does the book say is a good dosage, Lori?
Anywhere from 20 to 80 milligrams per day.
Okay, and she's getting what?
She's getting 40.
Okay, we're within realm. That's good.
Okay. And some of the things that I needed to do, assessments that I needed to do is it can be taken with or without food.
Mm-hmm.
She doesn't take them crushed. She actually takes it whole with applesauce. So
Okay, good.
I don't have to worry about that. It says to assess her daily weight, but she's not on a daily weight.
Mm-hmm.
It says also to assess her INO, and she's not on INO.
Okay. How about vitals? What vitals would you be looking at?
Her blood pressure and pulse.
And what were those today?
I did her blood pressure this morning,
Okay.
and her blood pressure was 128/82 on her right arm, and her pulse was 72.
When would you hold this? For what blood pressure would you hold this?
I would hold it if her systolic was below 100.
Okay, good. Because what is this going to do? What is Lasix going to do to her blood pressure?
It's going to decrease it.
Very good. Excellent.
It also wants us to look at our electrolytes because it decreases a lot of the electrolytes. So
which one in particular do you think?
potassium.
Absolutely.
Potassium, and her potassium level is 4.3, which is within normal limits.
Okay, good. That's the one I was looking for.
Good. And some side effects of Lasix: dizziness, blurred vision, tinnitus, hypotension.
What's tinnitus?
Tinnitus is ringing in the ears.
Excellent. Okay.
And also Stevens-Johnson syndrome and toxic epidermal necrolysis.
Okay, and what are those?
I could never remember them, so what I did is I wrote them on the back.
Oh, that's perfect.
Stevens-Johnson syndrome is a red rash, fever, kind of on the lips, face, mouth area, and toxic epidermal necrolysis is more like it looks like the skin is scalded.
Okay.
And it can be fatal.
All right, good. And again, you talked about that. Hypotension is a real biggie with the Lasix, and we already talked about her blood pressure. Okay, good.
Good. I'm going to finish my third check now.
Okay.
Which is, I'm a collector. Birthday is 7/15 of 40. And this is Lasix, 40 milligrams, PO daily.
Okay.
And I don't know if I told you or not. I'm going to wash my hands before I pop this out.
Okay, good job.
And I think the numbers are the day of the month, right?
It is.
Okay. So today is the 20th, and here's my capsule right here.
Okay.
And I think what I'm going to do is I'm going to just put that right underneath the bubble pack.
Okay.
Make sure I'm on the 20th and pop that out.
Wonderful. That's perfect. You did real good, Lori.
Okay, thank you. My next med that I'm scheduled to pass is for I'm a collector. Her birth date, 7/15 of 40. And that's digoxin, 0.25 milligrams PO daily, and the expiration date is 2 of 14.
Okay.
And my med sheet, she takes 0.25 milligrams daily.
Okay.
That is a little bit higher than the geriatric dose, but within the normal maintenance dose.
Okay.
She takes hers for atrial fib.
Okay.
It increases the force of myocardial contraction.
Okay.
It actually increases cardiac output.
All right. Good. What is that going to do to the heart rate?
It's going to decrease it.
Yep, it is. It's going to slow everything
Yep, it's
down.
going to slow it down.
Okay.
And we already talked about her apical pulse was 72, I believe, right?
And you checked that for a full minute?
I checked it for a full minute.
Okay.
If her pulse was less than 60, then I would hold this medication.
Excellent.
And I would note any rate, rhythm, quality changes. It also says we need to check a DIG level, and her DIG level on her labs was actually within normal. It was 1.8, and that's
Okay.
within normal. So I guess this dose is working for her.
Good, good.
We already said she's not on INO, she's not on weights. She didn't have any edema.
Okay, good.
We talked about some of her electrolytes already, but all of her electrolytes that we write down, the first 4, are all within normal limits.
Okay, good.
We're supposed to monitor for DIG toxicity.
All right, and what are some symptoms of that?
That is abdominal pain, anorexia, nausea, vomiting, visual disturbances, a slow heart rate, which is bradycardia.
That almost looks like the flu, so it almost
Yeah.
looks like the flu signs and symptoms.
Okay.
Okay.
And then some of the side effects, fatigue, arrhythmias, thrombocytopenia,
Which is what?
decrease in platelets. I wrote that down.
Okay, good job.
Okay.
All right, very good, Lori. That was good.
Okay, so those are the 2 medications that I'm scheduled to pass, but let's go through the second check here. Again, I'm a collector.
Or
I'm
the
a collector.
third. I think that would be the third check.
That's the third check. Thank
Okay.
you. I'm a collector. 715 of 40, and it is digoxin, 0.25 milligrams PO daily, and that's her, and it expires on 2 of 14. And
Okay.
today is the 20th.
So
I'm
we'll
going to
pop
put that
out.
over the top of the card here.
Wonderful.
Now she takes these whole with applesauce, so I would take my applesauce
Mm-hmm.
and I would open that up. And I'm just going to put a little bit in there. I don't think she takes much usually. Okay, and I'm going to have that ready to go when I go into her room.
Okay.
I also have a glass of water that I can use for her to swallow her pills.
Okay, good. How about if we just, for the purposes of this video, let's go through a couple other medications, just how we would access those.
Sure.
Okay. If you had to do a milk of magnesia.
Okay.
That's
She
a
actually
liquid.
she actually has an order on here for milk of magnesia. So I would go into the cart, and typically milk of magnesia, I think, and correct me if I'm not right, I think all the residents can use the milk of magnesia. It's not
Yep.
labeled with her name.
Right.
So it's called, I think it's called a stock med.
Yes, it is.
So
a
here
stock
we are.
med.
MOM stands for milk of magnesia, and it's milk of magnesia, and it's 30 milliliters. She can have PO today.
All right,
And
good.
so I'm going to have to shake that up.
And did you check the expiration date?
I didn't. It is right here, 4 of 13.
Okay, good.
And I know we would go through our med med sheet, but for the purposes of demonstration, I think we're just going to go ahead and just pour that.
Okay, good.
And on here, it doesn't actually tell you how many milliliters, but I know that there's 15 milliliters in a tablespoon, so I'm going to have 2 tablespoons to equal 30 milliliters.
That's beautiful. Cap upside down. You're
Cap
doing
upside
well.
down, good. And I'm going to just make sure I know where this is, and I'm going to go ahead and pour this. It gets kind of thick,
There you go.
and I'm just going to, I just want to take a peek. Okay. And look, I got some on the side, so I would want to make sure that I have a Kleenex or a tissue to wipe that off because this gets all dried.
Okay. All right, then let's go find one medication that you would, it's a powder, some Miralax. Let's try some Miralax, Lori.
Okay, so let's go. And I'm going to pull that out. And here, that is down in the bottom drawer.
Mm-hmm.
And,
There you go. All right, that's good.
okay. And the Miralax should have her name on it. Because
Okay.
that should be her own. That is not a stock med.
Okay.
So here we have Miralax as ordered, and it's 17 grams PO daily.
Mm-hmm.
And here it's Miralax, and inside the cup it'll say 17 grams. And the expiration date is 12 of 13, so that's good as well.
All right, good.
So when we open this one, you can see on the cover, right above the white, it says 17 grams.
All right, good.
So we're going to pour that. And sometimes you have to kind of shake it a little bit to get it so that it's right at the right height.
Mm-hmm.
And then what we're going to do is I'm going to add it to my cup of water. And I'm going to stir that around so that by the time we get into the resident room, that it's going to be good to go. And it should be a full glass of water that they drink that with.
Beautiful. Nice job pouring that. And you're keeping your caps upside down. That's great. And how about if you had to get out a medication that was several medications that were in there, so a stock container, perhaps fish oil.
Okay, so I would go in my med cart and I would grab the fish oil.
Mm-hmm.
And this says fish oil with vitamin D3. And it also says fish oil with vitamin D3. That symbol right there means 2 tablets or 2 pills. PO twice a day at 8 o'clock.
Okay.
So let's see if I can find the expiration date here is 4 of 13.
All right.
And what I'm going to do is I'm going to open, then I'm going to get my cup over here. And I'm just going to be able to pour that right into the cover. I'm going to just dump that one in because sometimes you get more than what you need, really. There we go. Okay, and I'm going to put the cover back on there. Make sure that's closed. I do have a tissue now that I can actually wipe this off so that this doesn't get all. And I'm going to put the cover back on there. The other thing that I think we should talk about is if I have a small amount of fluid, I actually could pour my fluid into a medication cup and actually take this off, put the cover down, and actually draw it up to get an accurate dose.
And you would always use an oral syringe for that.
This is an oral syringe, so if I needed a 0.5 milliliter, I could get it up to a 0.5 milliliter, and that would be an accurate dose if I had a small amount of liquid that I poured into here.
Nice
And
job.
I could do that. Okay.
Come on in.
Hi, I'm back.
Oh, okay.
I have your morning medications for you.
All right.
Can you tell me your name and your birth date?
Sure. My name is I'm a collector, and I am 7/15/40.
Very good, thank you. Can you put your head up just a little bit more for me? I'm gonna go wash my hands here real quick.
Okay.
And it says, Ima, that you take your medications with applesauce.
Mm-hmm.
Okay? And I know you didn't have anything to drink yet this morning. Do you just want to take a little sip of water before
sure.
I give you those? Good. Do you want to just hang on to that
Sure.
all right, so I have just your 2 pills here.
Which ones are those?
Your first one is your Lasix, which is your water pill. It's going to make
Okay.
you go to the bathroom.
Okay.
And then your second one is actually your heart pill, which is your digoxin.
Okay.
Okay?
Mm-hmm.
And there's just a little bit more. I want to make sure I get it all in. There we
Okay.
go. Good.
Mm-hmm.
And you got those down?
Mm-hmm.
Okay,
They
good.
went down real good.
Good. Then I have your fish oil gummy
Oh,
bears. Or
okay.
gummies.
Okay.
Oh goodness. Okay, so a couple things we could do. If Ima could pick it up herself, she could pick it up herself
Okay.
because it didn't contaminate anything. Or if I have a glove, I could put a glove on and pick it up
Mm-hmm.
and actually put it in Ima's mouth, which
Okay.
is you.
Okay.
Could do that. Or if I have a Kleenex, I could actually pick it up and either put it back in the cup for Ima to take. We don't want to ever touch it with our hands.
Okay. So I can take
Yeah,
this
so go ahead and take that. See if you, there you go. Good. Do you need some water?
now? Yeah.
Because you also have your Miralax to take yet too.
Oh, I have to take that now?
Yes, after
Okay.
you're done with the water, I'll have you actually take your Miralax.
Okay.
And it just is a whole glass of water.
All right.
Great. Thank you. So the only thing you have to take yet is your Miralax.
Okay.
Just pretend. Good. Thank you. You did a nice job.
All right.
Okay. I'm going to go document that I did give you your morning pills.
Okay.
And then I'll be back to get you to breakfast.
Sounds great.
Okay. Thank you.
Mm-hmm.
Okay. I'm going to come back to document Ima's collector's medications that I gave this morning.
Wonderful.
And today is the 20th. So again, we're just kind of taking a quick peek. That is the WK6.
Okay.
40 milligrams. And we're going to come all the way over to the 20th, which is here. And I'm going to put my initials here.
Okay.
Stating that I gave that 8 o'clock dose.
Okay.
The next thing I'm going to do is just kind of eyeball this again. Digoxin, 0.25 milligrams. It was the 8 o'clock dose for I'm a collector.
Yep.
Again, looking at the med sheet. And again, it's the 20th, so I'm going to come down and I'm just going to put my initials here.
Great.
Then the next one I'm going to go to document on is the Miralax, 17 grams I gave, and that's sitting right here. And again, that was the 20th, so I'm going to come down and I'm going to put my initials there. And then Ima also took her fish oil tablets, or gummies I should say, and so I'm going to come and I'm going to initial there. And then what I would do is I would put my bubble packs and all of my medications back in the med cart where they were, and then I would be done.
Okay, nice job, Lori. That was a very good med pass.
Thank you.